Genius EVOCON is revision knee system, designed to offer pain-free mobility. It restores anatomical alignment and functional stability. After examination and preparation, make incision as per required approach to expose knee. First step is to remove previous implant. Use reamer as per required size. Ream the canal until the surgeon feels the cortical resistance using the reamers. Each reamer has a reaming depth marking for 40, 80, 120 and 160 mm. On final reamer size, insert the tibial boom over drill, and then 8 mm sleeve tube. Mount the cutting guide with tibial boom. Position the stylus on tibial surface and fix the boom by tightening the nut on the boom against reamer. Ensure that the tibial cutting block touches the anterior surface of the tibia. Stabilize the tibial cutting guide with headless pins. Use the angel wing through the preferred cutting slot of the tibial cutting guide, and adjust the boom position in such a way that the angel's wing indicates the desired level of cut. Fix the boom position by tightening the knob on the tibial boom. This will ensure a 3-degree tibial cut. Remove the cutting guide and remove the tibial boom. Insert the cutting guide over the guide pins. To check alignment extramedullary, insert drop rod adapter in the slot of tibial cutting block, and slide mechanical axis alignment rod. Remove the mechanical axis alignment rod and drop rod adapter. Take either full cut or partial cut as per requirement. Remove pins and cutting guide. Provisional augments or provisional tibial half augment can be used as per requirement. Place the base plate over tibial plate, and decide the ML or AP sizes. Place the straight tibial offset bush over the tibial base plate. Adjust the tibial offset bush and insert pins. Remove the bushing and reamer, leave base plate only. Place the corresponding size of broach guide over the base plate. Assemble broach with modular broach handle slot, and impact the broach handle, to insert the broach completely into the tibia, till the broach handle touches the broach guide. Remove broach, and the broach handle. Insert the tibial peg drill, through broach guide to make the proximal cavity for the stem. Remove the broach guide, pins, and base plate. Provisional stem rod is fixed with the provisional stem adapter, and then the assembly is fixed with the provisional tibial tray, at the previously defined rotational position. Femoral preparation. Make the cavity using a reamer as per the required size. Place the valgus guide, 6 degree, on the shank of the stem reamer. Place DFC cutting guide over valgus guide. Insert pins to stabilize DFC cutting guide. Remove pins. Remove valgus guide, DFC cutting guide, and reamer. Use the angel's wing to assess the desired level of bone resection. Take appropriate cut by using 1.27 mm blade. Remove pins and valgus guide. Based on selected size, slide the AP jig over the reamer. To take anterior referencing, slide anterior reference flange in the anterior slot of AP jig. Place the appropriate offset bush guide, left or right, on the AP jig, depending on left knee or right knee. Slide the straight bush into the bush guide and check for optimal fitment. Stabilize the AP jig with side pins. Remove the straight or offset bush guide, and reamer. Take the anterior and posterior resection. Then slide the offset bush guide in AP jig and femoral stem base reamer guide on the bush guide. Ream the femoral stem base using the femoral stem base reamer. This will make space for the proximal stem region. Remove the offset bush guide, stem base reamer, and femoral stem base reamer guide. Insert headless pin in 2 holes of AP jig. Remove side pins and AP jig. Use the gap balancer to stretch the joint at the 90-degree flexion position so that the collateral ligament tension of both medial and lateral is in equilibrium. Slide box and chamfer cut instrument over referenced AP jig pin and stabilize the block with headed pins. Take the chamfer and box cuts using the box cutting guide. Remove box, chamfer cut, and pins. Remove pins. Based on the noted femoral size offset and diameter, make assembly of provisional femoral component and the provisional stem with the screw and Allen key. If required, take additional resections for the posterior and distal augments. Remove the provisional femoral component. Remove the provisional tibial component. Apply cement on the tibial bone. Then insert the final tibial implant. Slide the tibial insert to engage with the dovetail lock of tibial tray. Apply cement on femoral bone, and on cement pocket provided in femoral component or femoral augments, tibial implant, and augment.